Hello and welcome. Today we have with us Dr. Ashish Mishra, a liver transplant surgeon. Welcome, sir. So now my question is that we have seen a lot of cases of kidney transplant or heart transplant where the organ has come from pig. Is there any scope of such in liver transplant also?
Yeah, it's a very good question. The thing is that these are all in experimental stages. So, the University of Alabama had a long research for almost 20, 30 years, and they had genetically engineered pigs, and they started, matching the genome of the genetically engineered pigs with the humans. But eventually, we see that these kidneys last for some time, but they are not lasting as much as a normal human kidney or a normal human donor would last. So, yes, things are being done, but they are not long lasting. They have their own problems. I am sure with the evolution of things, sooner or later we will get there, but right now we are not there.
Right, sir. And so, when it comes to liver transplant, and there are two ways, if I'm not wrong, from a deceased person and from a
Yes.
living donor. What is the one thing that everybody must keep in mind when you are getting a liver transplant from a donor? And let's say if it's outside of the family.
So, by law, a living donor cannot be done outside the family. Okay? So, only the near and dear ones are allowed to donate and a living donor. But as far as deceased donor or donation after brain death is concerned, they can be, obviously, they will be non related. They are usually patients with road traffic accidents or with gunshots wound to the head. And in these patients, the brain stops functioning, but the rest of the organs are functioning. So, if the patient's relatives agree, then we proceed and take the organs, because the patient is not going to live once he is brain dead. So the thing is that if you are doing a living donor, then the donor has to be fit, slim. The liver fat content has to be less. If it is a deceased donor, then the liver functioning has to be good. Otherwise, the liver will not function in the transplanted recipient. So we have to be very careful in both modalities. But as I say, that if we increase the organ donation in India, we have so many road traffic accidents that we will be able to transplant the entire country without the need for a living donor donating. So if we really take up this thing, that all of us commit to this, that we will increase organ donation after brain death, then I think the shortage of organs will not exist.
Right, sir. Right, sir. So now coming to the last question, what is the one biggest misconception that you have come across associated with liver transplant?
I think that's an excellent question. There are a set of myths around liver transplant. The first and the foremost myth is that after liver transplant, patient does not live a normal life, which is a huge myth. Because when the patient comes to us, he is nearly dead. He has a big belly, jaundice, and he can't function. He's on the bed all the time. 3 months to 6 months after transplant, patient goes back to his normal life. He can go back to his work. He can go back to his kids. And the most stark example is that if a lady is in pregnancy age, if she has liver disease, she cannot conceive. But after the transplant, they can conceive. So it's absolutely normal after the transplant. That is the first very important myth that people, because they take a case of one or two cases which have failed, and then they propagated that it is a failure. The success rate is 90 to 95%, which is a huge success rate. Because without transplant, 100% of these patients will not survive. So if you are giving a hope of 90 to 95%, you are giving a huge hope. So people should take that chance once their doctor advises. The second myth is that after donation, donors don't live a normal life. One of my patients recently, they have World Transplant Games, every year in the world. Recently they were held in, I think, Berlin or Germany. And I am so proud that one of my patients, who is a donor, she won 3 gold medals after donation, 7 years after donation. So these two myths, that they don't do well after receiving the organ and they don't do well after giving the organ, they both are myths and huge myths, and that should be removed.
Right, sir. Right, sir. Thank you so much, sir,
Thank you.
for addressing these
Thank you,
questions.
sir.
Thank